have cancer. But a new cancer center in Connecticut is helping many fight their disease, and CT Style reporter Megan Yost is here with more.
Thank you, Ryan. Cancer is a scary diagnosis, but thanks to the Hospital of Central Connecticut's Cancer Institute, those who have it can still live a long and healthy life. I recently met a Harwinton resident who is fighting the disease and plans on coming out on top.
At first glance, you might not realize it, but Carl Pallokat is battling cancer.
Gorgeous day for something like this.
This isn't the 73-year-old's first or second bout with the disease. It's his third.
And I'm a fighter. I'm not one that's going to let this get me down.
After being diagnosed and treated for thyroid and prostate cancer, Carl is now facing colon cancer with the help of the skilled doctors and nurses at the Hospital of Central Connecticut.
It was very upsetting, and I said, oh my goodness, what am I going to do? And then we met the great doctors here at the Hospital of Central Connecticut, and they said, no, we can treat it.
With 100,000 square feet of clinical and medical office space, HOCC's Cancer Institute is the largest facility in the region dedicated to cancer care.
Every 2 weeks, Carl goes to the Hospital of Central Connecticut's Cancer Institute for a round of chemotherapy. Carl is at the hospital for 5 hours at a time, but he says when it comes to his cancer treatment, the staff at the Hospital of Central Connecticut have made all the difference.
I enjoy doctors and nurses who come into a room with a smile on their face. That makes you feel at ease.
In the brand new infusion area, Carl has time to take in the beautiful views of the walking path just outside his window and enjoy a moment of quiet reflection.
It does give you time to relax. You can line up with your feet up in the air, lean back and enjoy the view.
In the Cancer Institute's lobby, there's even soothing live music. Carl's battle with cancer may have lasted more than a decade so far, but it hasn't dampened his spirits. His advice to others facing a diagnosis?
Relax, fight it. Don't let it get you down.
And as for Carl, he continues to stay active on his farm, and he hasn't stopped looking at the bright side. When asked where he sees himself in 5 years, here's what he had to say.
I hope I'll be in remission, and I hope that we have taken care of it. But if not, we'll just keep on fighting.
A fighter for life. For CT Style, I'm Megan Yost.
He sure is a fighter, and right now we are joined by the man who is helping him through this battle, Dr. Brian Byrne. He's an oncologist at the Hospital of Central Connecticut's Cancer Institute. Welcome here to CT Style.
Thank you for having me today.
Absolutely, Doc. So it's great watching you here in studio, watch that segment, the smile on your face, seeing Carl on the farm. For you, all the medicine aside, how does it make you feel at the end of the day when you're able to help these patients, not with the first or second bout with cancer, but the third? I mean, really incredible.
One of the pleasures is watching patients going through cancer, going through the treatment, but able to do the things that they enjoy. Carl's very active. He's on the farm taking care of his chickens, the cows. He also has his own little eBay business where he's selling things from the farm.
No kidding.
Enjoying UConn women's basketball. So seeing him do the things he wants to do, achieving his goals, enjoying his family, feels like I'm doing my job for him.
Yeah, and I'm sure you become part of that family, and I'm sure he's very appreciative of the hard work that you're doing. And it's hard to believe, dealing with cancer once, a horrible thing, twice, 3 times. Now for people like that, is there a better chance when it comes to the third bout, second bout?
There's been a lot of progress made in cancer treatments. We've gotten away from just trying to give the highest doses of therapy, more working on quality of life, supportive care measures, introducing new clinical trials, trying to use new drugs, immunotherapy drugs, using the patient's own immune system to fight the cancer.
Yeah, well, I think it was very interesting to see how much at ease he seemed in the new infusion area with the beautiful view outside and the live music. What do you see patients when they're in that situation? You're kind of taking away some of that pressure and stress. How are you guys able to help them through that?
I think it makes them more comfortable. And the more comfortable they are around the people taking care of them, the better they do, the more willing they are to share side effects, what's going wrong with treatments, and what's going right, so you can help people in the future. Yeah,
well, it's wonderful work that you are doing, and upcoming in May, you're actually helping people who have battled cancer in the past. What are you guys doing through this program?
In May, there's right now we're affiliated with Memorial Sloan Kettering. We're trying to get new clinical trials, new research. We formed the Hartford HealthCare Cancer Institute, where we linked up with other hospitals in Connecticut, to share our knowledge and to learn from what others people are doing well to help treat people.
That's great. Again, such wonderful work that you're doing, and you've provided such great care to Carl. How is Carl doing? I mean, since that report.
He's doing amazingly well.
Yeah?
He just was at the Women's Final Four, remaining active and busy.
Wow, check that out. So Carl, hopefully you're watching this right now. So very important that you're able to help these people. And we actually are going to send things back to Megan Yost.
Transitions for cancer survivors will take place from 5:30 to 7:30 p.m. on May 5th, 12th, 19th, and 26th. To register, visit hartfordhealthcare.org or call 1-855-HHC-HERE.